Hi, my name is Dr. Josh Hustedt. I'm a hand, upper extremity, and peripheral nerve surgeon in Phoenix, Arizona, and founder of the Joint Denervation Consortium. A joint denervation is a new, minimally invasive surgical approach to the treatment of joint pain. Traditionally, we treated joint pain with cortisone injections, which reduced the amount of inflammation, or joint replacement, which took away the bad parts and replaced them with replacement parts. However, a denervation is a new approach where instead of replacing the joint, we just identify the nerves that go to the joint. We cut those nerves away from the joint, and in certain areas, we cut them and transfer them to surrounding muscle. When we cut the nerves and we transfer them to surrounding muscle, those nerves then grow into the muscle. What happens is what was once a sensory nerve then becomes a motor nerve as it grows in and innervates the surrounding muscle. That causes a cortical response in the brain, and it tricks the body into thinking that you don't have pain in the joint. We've seen the best results with joint denervation of the hand, wrist, and the knee, specifically for patients who are high risk for joint replacement, particularly patients for the knee who have elevated BMI, elevated hemoglobin A1C, or significant comorbidities and are found to be non-arthroplasty candidates, or patients who have already had an arthroplasty and still have pain. In the hand and the wrist, we found it to be very helpful for base of thumb arthritis, as well as arthritis throughout the small joints of the hand and in the wrist. One of the biggest questions I get asked is, will I lose function? And I think of it this way. You have a freeway and you have on and off ramps. What we're doing is we're actually identifying the nerve to the end of the finger, and we're closing down the on and off ramps to the joint. We aren't closing down the freeway to the end of the finger, and so you'll have total normal function of the hand that's denervated. However, we will take and sweep off those little nerves that go as the offshoots to the joint. So you'll reduce the amount of pain that you feel in the joint itself while maintaining function throughout the hand. I'm also commonly asked about what is the long-term effect of denervation. For instance, in a weight-bearing joint like the knee, people always wonder if we take away the pain, if we'll just continually wear out the knee and we'll wear it out very quickly. It turns out, though, that what we're really doing is a partial denervation. We're taking away the sensory nerves that transmit pain to the brain, but we aren't taking away every nerve, particularly the proprioceptive nerves, which allow us to see how the joint is functioning in space. We have 3-year outcome studies that have shown very little advancement in arthritis after a knee denervation procedure and also after a CMC denervation procedure. This procedure seems to be safe and provide long-lasting pain control. We're glad that you found your way to jointdenervation.org. It's a great way to learn more about whether or not you're a candidate for a joint denervation procedure. Please peruse this website and feel free to use our Find a Physician button to find a physician near you that can discuss whether or not joint denervation can help you in your life.